Hello everyone, I am Ameer Ali and today we will be discussing case studies in health data science. We are positioning health data science as a transformative field where data is not only collected but analyzed and applied to improve global and local health outcomes. Explore what health data science is, why it matters, and how global and local examples reveal both opportunities and pitfalls. How data-driven approaches have reshaped healthcare from predicting disease outbreaks to managing hospital resources. What is health data science? Basically, it is an interdisciplinary field which combines health, statistics, and computer science. It applies big data, AI, and analytics to improve outcomes. It also supports evidence-based decision making in healthcare. This Venn diagram visually explains that health data science is a combination of three main areas: data science, artificial intelligence and machine learning, and statistics. Data science is overall field of using scientific methods, processes and systems to extract knowledge and insights from the data, while artificial intelligence and machine learning are techniques used to enable computer systems to learn from data and make decisions or predictions, while deep learning is a subset of machine learning, which involves more complex neural networks for tasks like image and speech recognition, while statistics is a mathematical foundation for collecting, analyzing, and interpreting data. Why case studies? So, case studies are used as a teaching tool because they are much more than simple examples. They connect theory to practice, showing how concepts from previous slides are applied in real world scenarios. They highlight both opportunities and pitfalls, demonstrating the potential for success as well as risk of failure. We will explore how data science is being used to tackle major global health challenges. Global health challenges. We will explore how data science is being used to tackle major global health challenges such as pandemics, in which we use data to track disease spread and model outbreaks, chronic disease management, in which personalizing treatment plans and monitoring patient health has an high impact, resource allocation, by optimizing hospital resources like beds and staffing, inequalities in healthcare access by identifying underserved population and improving outreach. We will be looking at how data science address some of the biggest global challenges like managing pandemics, tackling chronic disease, and ensuring fair access to care. The map you see here on the screen is from the WHO, which illustrates the complexity and global nature of these issues. This is the landscape in which you will be working. Global case studies. Why are case studies so important? So they help us to move beyond theoretical concepts and see how these tools are applied in real world. They highlight both the incredible opportunities and serious pitfalls we need to be aware of. They force us to think critically and develop our problem solving skills. Our first major case study is the use of COVID-19 dashboards. With a focus on Johns Hopkins University dashboard, which quickly became the global reference point. This dashboard was a masterclass in data aggregation, pulling information from organizations like WHO and CDC to provide a real-time global picture of the pandemic. Its impact was immense. The data informed major public health decisions from travel bans to vaccine distribution. It also provided a vital tool for researchers to model the spread of virus and forecast future needs. This is image which you are seeing is from the John Hopkins COVID-19 dashboard. COVID-19 dashboards gaps. While successful, these dashboards face significant challenges. Data delays were common, especially in countries with less developed health infrastructure, which meant the real picture was often a few days behind. Another gap was underreporting. Underreporting of case and deaths were also a major issue, as not all cases were tested or recorded. Furthermore, there was no universal definition of case, which made cross-country comparison difficult. Locally, Pakistan's NDMA dashboard faced similar challenge and lack transparent and timely data led to breakdown in public trust. This highlights a crucial ethical dilemma and trade-off between public health needs and individual privacy. The ethical issues in these COVID-19 dashboards. Despite their success, these dashboards were not without their flaws. We have saw significant gaps, particularly in low-resource countries where data collection was slow or incomplete. Underreporting was a major issue, and different countries had different definitions of what constituted a case, which make accurate comparison difficult. Locally, Pakistan's NDMA created a similar dashboard. While it was a great effort, it highlighted the same challenges, underreporting, delays, and a significant issue with public trust. This brings us to the core ethical question. How do we ensure data is transparent and accurate? Who has the right to use this data? And how do we balance public needs to know with an individual's right to privacy? IBM Watson for an oncology promise. Let's turn to a different kind of case study. IBM Watson for oncology. This was an AI tool that was marketed as a revolutionary system to help doctors suggest personalized cancer treatments. Promise was that it could process vast amount of medical literature and patients' data, provide expert recommendations faster than any human could. However, the reality was different. What are the challenges? The system faced major accuracy issues. Its recommendations were sometimes unsafe or simply incorrect, largely because it was trained on limited data from a few specialized hospitals in the United States. This created a significant bias, and the recommendation often did not fit the realities of local contexts or different patient populations. This is a powerful lesson in the dangers of overhyping technology and the critical importance of diverse representative training data. However, it largely failed due to major challenges. Its recommendations were often inaccurate or unsafe because it was trained on limited data from few hospitals, created significant bias. The recommendations offered did not align with the needs of a diverse patient population or the reality of treatment. This case study teaches us a critical lessons. AI tools must be rigorously tested in real-world settings, and a diverse data set is essential for reliability to avoid overhyping technologies. NHS data projects, predictive analytics in healthcare. The UK National Health Service or NHS has been a leader in using data science. They have used predictive analytics to forecast demand in emergency rooms helping them better allocate resources and staff. They also used AI for early detection of serious conditions like sepsis and eye disease, which improve screening and diagnosis. What are the controversies for this NHS data project? These projects were not without controversies. The partnership between the NHS and Google DeepMind raised major public concern about patient privacy and consent, especially when it was revealed that large amount of patient data has been shared. These controversies ultimately shape future generations on how health data can be shared, used. Remind us that public trust is a fragile and essential component of any data project. Google DeepMind streams. Inspired by the structure and function of human brain, DeepMind employs artificial neural networks. These networks consist of interconnected nodes, mimicking how neurons work together. By processing data through these networks, DeepMind's AI can identify patterns and relationships within the data. Two more major global applications are contact tracing apps and large-scale genomics projects. Contact tracing apps were a high-tech response to the pandemic, but their success varied widely. In many places, they had low adoption rates due to privacy concern and technical issues. People are simply not comfortable with their movements being tracked. Local and regional case studies. Now let's shift our focus to some local and regional case studies that are closer to home. A great example is Pakistan's use of data to fight polio. They use GIS mapping to track unvaccinated children, allowing them to pinpoint and target high risk areas, where field workers used mobile apps to report real time data, which improved accountability and efficiency. In Karachi, mapping projects have been used to identify underserved areas and link them with community health workers to provide better outreach. These projects prove that even with limited resources, smart data application can have a huge impact. This is the example of GIS tracking. In Pakistan, GIS maps were used to pinpoint unvaccinated children, allowing health workers to target their efforts. Mobile apps were also used for real-time reporting, which significantly improved accountability. This is the example of mobile apps. Spatial data was used to identify areas with limited healthcare resources. This information was then used to integrate with community health programs, ensuring better outreach to underserved populations. mHealth, which is mobile health interventions like SMS reminders, was used for maternal and child health appointments, which proved to be highly effective in rural South Asia, demonstrating that even low-tech solutions can have a major impact when applied thoughtfully. When we talk about the ethical consideration of polio data, it is important to remember that while the data helped strengthen eradication programs, it also created feelings of surveillance within communities. Many people felt as thought they were being watched or targeted, which reduced their trust in health workers. The key ethical challenge here is balancing urgent public health goal of eradicating polio with fundamental right to privacy and dignity. Communities must know why data is being collected and how it will be used. Without this openness, data collection risks aligning the very people it seeks to help. It would end by posing the question, How should public health leaders balance this pressure to achieving eradication targets, responsibility to respect community trust and individual rights? Apps for maternal health take this idea further. These apps allowed healthcare workers in rural South Asia to track indicators such as antenatal visits, blood pressure, or nutrition. This gave health workers the ability to intervene early when they noticed risk. However, despite their usefulness, these tools were not without limitations. Low literacy level meant that many women could not use this app directly. Access to mobile phones was also uneven, with many households prioritizing men access over the women. So we need to think what strategies could make sure that digital health tools are accessible to all, including women in low literacy settings. Now we look at the challenges with M Health initiatives. Number one, poor infrastructure, such as unreliable internet or electricity, meant that even the best design app could not function consistently. On top of that, low literacy created serious barriers for adaptation, especially among rural women. These challenges highlight the fact that technology cannot be parachuted into a community without adapting it to local context. For digital health to succeed, infrastructure and education must go hand in hand. When communities are part of design process, they can help identify barriers and solutions that outsider might miss. And COVID-19 data. Pakistan's COVID-19 dashboards were a major effort by NDMA and Ministry of Health to monitor cases and hospital capacity. These dashboards become critical for policymakers and frontline teams. They enable rapid situational awareness across provinces, which help in tracking hospital capacities and cases. Despite these dashboards, Pakistan faced key challenges. Data was often delayed or inconsistent across provinces, this leading to gaps in real-time response. This highlighted how fragile the surveillance infrastructure was during public health emergency. Here we see the challenge of M-health interventions. Infrastructure gaps such as weak internet and electricity often disrupted consistent use. Main lesson learned from Pakistan's COVID-19 data experience is the urgent need for stronger surveillance and integrated health information systems. Transparency and data sharing protocols are vital for future pandemic preparedness. Ethical considerations. Privacy and confidentiality remain a core ethical consideration in health data science. Breaches of medical records can cause harm, stigma, and long-term distrust in health systems. Strong governance frameworks are required to ensure protection. Data security. Data security is another challenge. Cyber attacks on health institutions have become more frequent, showing how vulnerable sensitive health data is. Protecting servers, cloud systems, and mobile applications is critical to prevent catastrophic leaks. Algorithm bias. Algorithm bias is a growing concern in AI-powered health systems. When training data underrepresents certain population, the resulting algorithms produce skewed results. This can worsen inequalities in diagnosis, treatment, and care delivery. Transparency. Transparency in algorithms and AI systems is crucial. Black box models reduce trust among both patients and clinicians. For health systems to adopt AI responsibly, decision-making process must be explainable and auditable. Informed consent is central to ethical data use. Patients must clearly understand how data will be collected, stored, and shared. Without consent, health data practice risk violating human rights and undermining trust. Ownership. The issue of ownership in health data is complex. So the question arises, should patients, governments, or private companies own health records? Without clarity, conflict arises around commercialization, access, and long-term data stewardship. Inequalities. Global inequalities in health data infrastructure show a clear north-south divide. The North control much of the storage, analytics, and platform, leaving developing countries dependent on external technologies. This limits local autonomy in data use. Frameworks. International frameworks such as WHO and OECD provide guiding principles for ethical data use. These frameworks emphasize accountability, transparency, and inclusivity, but implementation remains inconsistent across countries. So another case is of Cambridge Analytica. The Cambridge Analytica scandal, though outside health, serve as a powerful reminder. It shows how data misuse can manipulate population at scale, where health data systems must be safeguarded to avoid similar exploitation. Pakistan dilemmas. Conclusion and future directions. Local projects often struggle with balancing innovation with ethical safeguards. Strengthening data laws must be a priority for moving forward. Call to action. In conclusion, health data science offer enormous potential but comes with significant responsibilities. As future leaders, students must learn from these global and local case studies to shape an ethical, impactful